All right, we're recording. So, hi, my name is Kaylee Batterham.
Hi, I'm Dalen Fields.
Fernando.
And this is our movement assessment PowerPoint. So our scenario is we have a patient named Jimmy Jones. He's 18 years old and he had a ACL repair. His sport history is that he plays football and baseball and he works retail. So far, he has no medical concerns. He's overall healthy male and he just needs some corrective exercises to strengthen his knee joint and the muscle.
So the beginning stages when going through this corrective exercise continuum is going through the static postural analysis. The importance of this analysis, it gives the exercise prescriber the idea of what the client's overall body is looking like and where the muscle weaknesses and imbalances are. And we need to identify these muscle imbalances so that way future injuries and future pain issues can be avoided. So when we are doing this postural analysis, we need to start from the feet up, moving on to the knees, along with the hips, spine, shoulders, and head and neck, and so forth. So looking at Jimmy's postural analysis here, we can see that he has abnormalities in pretty much all four based on his history and what we have seen here, such as having not straight parallel feet, having abnormal knees that are not in line with the toes, an excessive forward lean in the shoulders, which can be due to the working in retail, and having excessive forward lean in the spine and shoulders, as well as the cervical spine.
Okay, so I'm just talking about the transitional movement assessment, and I'm just basically going over what you should be looking for when doing this. So starting with the overhead squat assessment from the anterior review, we want to go through a few kinetic checkpoints, starting with the feet and ankles. So in the middle, well, right here in the middle, we see that that's the ideal stance that we should be looking for. But here in this image, we have the knees moving inward. And when this occurs, there's probable muscle imbalances, such as the gluteus medius and maximus being an underactive muscle group and an overactive muscle group being the adductor complex. And then going on to the knees. Sorry, that was for the knees. For the feet and ankles, we have the feet turning out. And for that, oh my gosh, I completely reversed them right now. I did not notice that at all. Okay. So let's go back here. So what I was first saying, so let's restart. So the knees moving inward, we'll be looking for the gluteus medius maximus being the underactive muscles and the overactive muscles being the adductor complex. And there are a few other muscles that could be involved. And then for the feet, we had the feet turning out. And the problems here could be things such as the medial hamstring being a underactive muscle and an overactive muscle being soleus. Slide. Moving on to the lateral view, we can go over a few more kinetic checkpoints. So things to look for are in the lumbopelvic hip complex. We can look for excessive forward lean, and there we can identify underactive muscles such as the anterior tibialis and overactive being the soleus as well over here. And then we have the lower back arching and underactive muscles such as the hamstring and overactive being the hip flexor complex. Then lastly, we also have the shoulders for our connect checkpoints, and we have the arms falling forward. This is usually due to an underactive muscle such as rotator cuffs, posterior deltoid, and overactive muscle such as teres major, pectoralis major, and minor. All right, next slide. Then lastly, we have the posterior view for the overhead squat assessment. So the first image up above, we have which would be normal. And then below, we have a few examples of abnormalities. So going through the connect checkpoints here, we have the feet flattening, and this is a sign of underactive muscles such as the posterior tibialis, or overactive muscles such as bicep femoris. And then we have another abnormality having to do with the feet or ankles, the heels rising off the floor. This one right here, it solely has to do with the underactive muscle anterior tibialis and overactive muscle soleus. And then lastly, for the lumbo-pelvic hip complex, we have an asymmetric weight shift. And so for this one, underactive muscles can be the gluteus medius on the same side as the shift, and the adductor complex for the opposite side. And then for overactive muscles, we could have things such as the adductor complex for the same side and the bicep femoris for the opposite side. All right. And then lastly, for our transitional movement assessment, we have the single leg squat only from the anterior view. Right here, I have an image to the left, which shows what would be normal. And to the right, I did an assessment on my friend. And so we're just going through the connect checkpoints. We have the feet and ankles look normal. The knees look normal. The only thing that, I guess it's kind of hard to tell because of the sweater, but the LPHC, I think I noticed a hip hike, which is an abnormality. And this can do with the underactive muscles such as the adductor complex and the overactive muscle being the gluteus minimus.
All right. So in addition to those transitional movement assessments that Fernando talked about, there is also another form of dynamic postural assessments we can conduct in terms of a gait analysis, where we talked about the static postural analysis beforehand. Our student, client, patient, athlete would be in the standing static position, whereas analyzing the dynamic posture would be seeing the client in motion. So analyzing what abnormalities are present when watching someone walking or running are important aspects to observe to avoid injury, especially in the aspect of sports performance when it's at a high intensity. So the video that I provided here on this slide overviews a basic gait cycle and analysis assessment that takes a client through a basic gait analysis and shows from the ground up what is necessary and what needs to be looked for. Looking at our patient from earlier, in terms of an analysis, we had talked about from the feet up, there were abnormalities with the feet turning out, abnormalities in the knees moving inward. The LPHC was abnormal in terms of having lower back arches, and there were abnormalities with the shoulders falling forward. So in terms of the probable overactive muscles that are occurring in the feet, we could be looking at the peroneal complexes, biceps femoris, short heads, TFL, soleus, gastrocnemius. In the knees, we could be looking at the adductor complex, LPHC for the low back arches. We could be looking at overactive erector spinae or latissimus dorsi, and overactive TFL, gluteus minimus, as well as pectorals for the shoulders. And so for the underactive muscles, we could see that the gluteus medius, popliteus, hamstrings, and the gluteus maximus and medius could all be underactive when analyzing this particular patient's gait.
All right, and lastly, our additional exercise assessment would be a STAR excursion balance test. The purpose of this test is to measure multiplanar balance and neuromuscular efficiency during closed chain functional movement. And when performing this movement, compensation of this movement can result in knee valgus, which then affects balance. And the purpose of this test is to efficiently have balance. So if the compensation of the knee valgus affects their movement, it would be a failed test. So based on which direction the patient cannot complete successfully determines which plane of motion needs to be incorporated into their corrective exercise program. And that's it. Let's talk